5 Pacific, and I will turn it over to Shreya for our final session of the summit.
Hello and good afternoon, everyone. My name is Shreya Koirala, and I am the Public Health Program Coordinator for the Hepatitis B Foundation. Welcome to our final session for this year's mini-summit. Being a part of Hepatitis B Foundation and Hep B United and working closely with the Tuberculosis Elimination Alliance, I have gotten a chance to see how impactful mini-grants can be for organizations and coalitions working to address hepatitis B and TB. Excuse me. So it's my honor to introduce the HBUT Mini Grants panel today, where we are showcasing the incredible work of Hep B United and TB Elimination Alliance's Mini Grants program, as well as the incredible work being done by our mini grantees. To kick us off, we have Catherine Freeland, who is the Associate Director of Public Health Research for the Hepatitis B Foundation, giving us an overview of Hep B United's mini grant program. Similarly, we have Maria Fernandez Gutierrez, Program Manager for APIAHF, and Shibo Shinagawa, Program Manager for APJO, giving us information on the TB Elimination Alliance mini grants program. Passing it back to you, Frank.
Good afternoon, everyone. My name is Catherine Freeland. I'm the Associate Director of Public Health Research at the Hepatitis B Foundation, and I help to run the Hep B United Mini Grants program, which I'm going to give you a brief overview of today. So to give you a bit of background on the successes of the Mini Grants program, since 2014, we've distributed through the Mini Grants program at Hep B United over $500,000 to 18 states, supporting local partners to improve capacity and increase screening, education, vaccination, and linkage to care related to hepatitis B in their local communities. Historically, the awards were focused on Asian American and Pacific Islander communities, but over the past year, we were able to expand it to focus on outreach to communities who have injection drug use, who are African immigrant, Asian American, and Pacific Islander communities. So we're very excited to be able to open up this award through this year. And the purpose of the RFP, the request for funding proposals, and the mini grants is really to enhance the capacity of Hep B United Coalition partners to conduct best practice hepatitis B education, testing, and linkage to care in local communities. The emphasis is really focused on programs that address hepatitis B among these priority populations where we know there's high risk for hepatitis B. And these activities that are supported within this funding at the local coalition level are really working to advance priority areas at the national level for elimination of viral hepatitis with the U.S. Department of Health and Human Services Viral Hepatitis Strategic Plan, and also Hep B United's national priority areas as well. This focus this past year for our request for funding proposals was looking at our strategic priority areas that worked to increase awareness, screening, prevention, and education to reduce hepatitis B-related health disparities, including implementation of the new universal adult hepatitis B recommendations. So projects and proposals could focus on how they would best disseminate the new guideline recommendations from ACIP within their communities, and also working to include sustainable change within their local community clinic partners, for example, to improve vaccination and screening rates in their populations. Additionally, the second priority area is working to improve linkage to care and access to culturally and linguistically appropriate patient navigation services to prevent hepatitis B-related liver disease and cancer, or to strengthen surveillance or community-level data collection to detect hepatitis B transmission and disease trends. And these could look something along the lines of improving education, awareness, and screening, or even just improving the capacity of the coalition itself, developing the coalition itself, for example, to be able to carry out these strategic areas. So just to give you an idea on the process of what the application and the grant process looks like, we tend to release our requests for funding proposals in the summer. We do a forecast usually in May, and the RFP officially comes out in June along with the application. We try to make our applications as simple as possible for all of our applicants to try to make the application less burdensome on our partners and also just more equitably available to people and our community partners. We also have a review process. We have an internal and external review period. The external reviewers tend to be experts in specific populations, for example, and they provide some guidance on and their thoughts and feedback on specific proposals that they're assigned to. And then the internal review is from the foundation staff, and we take into consideration past funding awards for mini grants, geographic location, and also ensure that our priority populations all have representation equitably across the board. So we're distributing things both geographically, representing need, and also by populations. And then the notice of award and support comes out in September. Usually sometime in October, early November, there's an orientation call for awardees, as well as announcement of awardees at that time to be coalition partners. And then from there, the individuals are receiving ongoing support for implementation of their project throughout the duration of the year. The project usually goes from the end of September to the end of September as well, and grantees are asked to submit an interim report, usually sometime in May, and a final report usually by within a month or two after the project concludes. Historically, we've had projects that focus on education, screening, improving vaccination, or innovative ideas. So if you have a project that you want to pilot, for example, the Hep B United mini grant awards are great opportunities to pilot projects. We've had partners implement story circles, for example, which are great at improving capacity locally, raising awareness, and also just fostering a community lived experience platform in their spaces, which are great projects. We've also had innovative education within pharmacy settings, using diabetes as like a screening indicator for hepatitis B vaccination and screening in the pharmacy setting, which is really great. So just a couple of ideas and strategies that you might be able to think about implementing in your communities. We've also had electronic health record integration for hepatitis B screening and vaccination. And we always try to elevate our mini grantees through offering opportunities to share their work at our coalition calls, which happen monthly, or they can work with us to create a webinar or present during our summit, as we'll have a couple of examples just after I present. The requirements to be an awardee, first, to be a Hep B United partner. It's a very simple process. If anybody is working in the capacity of hepatitis B education awareness or screening, likely they're eligible, especially if they're working in partnership with other community-based organizations in their communities, demonstrating, again, that there's an active coalition, working in hepatitis B in any of the priority populations, and then also submitting your application. I'm always available as well to answer any questions about eligibility requirements or any sort of proposal ideas that potential grantees might have as well. I just want to say thank you so much for your time, and I encourage anybody to reach out if you're interested in learning more or being involved, and also be sure to keep an eye out in May of 2023 for our forecast, and then June for the official RFP to be released. Thank you so much, and hope you have a great rest of the summit.
This week is taking you on a journey into what TB and Hep B looks like from the eyes of survivors to providers, but I know it's useful to also see it represented visually. So we ask that you stay with us as we share our history and our future. My name is Maria Gutierrez. I am a steering committee member of the TB Elimination Alliance, representing the Asian and Pacific Islander American Health Forum. We're so honored to have everyone still being with us today, and I'll pass it over to Shibo, who will talk about the evolution of T and its gradual scope over time. Take it away.
Thank you so much, Maria. My name is Chibo Shinagawa, and my pronouns are she and her. I am a program manager of infectious diseases at the Association of Asian Pacific Community Health Organizations, APCHO. And through my work at APCHO, I support the TB Elimination Alliance. I'm very happy to be here with you all today and excited to share with you a bit more, next slide please, about the work that we're doing in T. So to give you, I'd like to give you all just a glance at the TB Elimination Alliance and more of a historical overview of the TB Elimination Alliance. We are thankful to be partnered by the CDC to fund 4 organizations, and that is the Forum, Stop TB USA, Hep B United, and APCHO. And all of these 4 organizations are also a part of our steering committee to lead the development of T. In 2019, the TB Community Engagement Network worked closely with state and local TB control programs, community-based organizations, and community health centers to implement activities such as T's mini-grants program and to eliminate tuberculosis for affected Asian American and Native Hawaiian Pacific Islander communities. Our goal was to outreach to Asian American and Native Hawaiian and Pacific Islander communities with the highest tuberculosis burden. The TB Elimination Alliance, previously known as the TB Community Engagement Network, was launched in July 2020. As you can see here on the spectrum, we went from a planning phase in 2019 to coalition building in 2020. Our goal was really to focus on the strategic planning, and over the past 2 years, T really became an alliance and a resource hub of knowledge. We held monthly meetings with local partners to build out the TB Elimination Alliance. We had a 2-year strategic plan focused on collaboration, partnerships, community engagement, access to testing and treatment, provider education, and research and data. Through this, we also held a national audience webinar, and each year we hold a learning collaborative. We also make sure that the TB Elimination Alliance is a resource hub for access to subject matter experts, and that we hold this annual TB Elimination Alliance and Hep B United Summit. In addition to that, we have our mini-grants program. The mini-grants program, very much is at the heart of the work that we do. We really want to spotlight our community health centers and community-based organizations that we work with. On the spectrum, we also would like to share some of our, please next slide. Some of the grantees from 2019 to 2023. And before I get into this, I'd also kind of like to share a bit more about the 4 goals and objectives of the TB Elimination Alliance. Our 4 goals are to conduct outreach to underserved Asian American and Native Hawaiian Pacific Islander communities with the highest TB burden, increase access and understanding of culturally and linguistically appropriate LTBI TB testing and treatment strategies, and share resources and best practices among providers. Finally, we really hope to develop partnerships that scale existing initiatives. In order to do this work, we want to increase the awareness and build provider capacity on LTBI, TB, testing, and treatment. T has offered mini-grants from 2019 to 2023 to organizations that serve Asian American and Native Hawaiian Pacific Islander populations. And this year, we're focusing on an expanded effort for health equity on working for to address LTBI and TB. We are excited about the impact of the mini-grants and we're very excited about the commitment of our organizations for community engagement and education, provider education, and quality improvement, and hope this will contribute to overall health equity goals. I'll pass it on to Maria.
Thank you so much, Shibo. Next slide, please. So one thing that's often not vocalized, especially in metrics, is how infrastructure dollars and these kind of grant funds are distributed for programs like T. And thanks to the ongoing support from our national partners at the CDC, BTBE, we've had the privilege, honor, and duty to award close to 40 grants in 17 different regions across the mainland US and US affiliated Pacific Islands. In these 4.5 years, we've awarded over $500,000 to support ANHPI serving community programs, clinics, and academic centers focusing on treating, preventing, and eliminating TB. But the important thing that we really wanted you to take from these metrics is that mobilizing communities and preventing the spread of disease like tuberculosis and hepatitis B is expensive. Community engagement and outreach is much more complicated than just printing out flyers. It can mean having the means to fill your car up to drive 80 miles for an outreach event. It can mean providing incentives like Metro cards or cash awards for community members to participate in surveys that will be used to design more culturally appropriate interventions. But the most critical element to the success of any community-based program is that it takes people, nurses, technicians, translators, outreach coordinators, media specialists, data analysts, program managers, and culturally representative leaders to show up and do the work. Over 70% of all the funds from our mini-grant program was allocated to finance capacity and equipment. So to fund these individual salaries, these healthcare benefits, to purchase microphones, tents, chairs, software licenses, all of the infrastructure to build a village, essentially, that is dedicated, motivated, and inspired to provide those necessary resources to community members at most risk. I think that is a reality that TB has continued to show us, but more recently that COVID re-emphasized, especially for those in our profession. Next slide. But if careful consideration, time, and resources are allocated to find those gatekeepers, to champion their efforts and uplift our community's narrative, we can accomplish incredible things. We can reach farther than what we would have without that kind of technical, emotional, and community level support. So the metrics here in this graph are pulled from our yearly reports and mini grants. And cumulatively, our preliminary data indicates that this mini grant cohort has been able to reach over 4,000 people. I want to reemphasize that this is preliminary, and in just shy of a year, this cohort was able to reach over 1,300 community members, patients, and at-risk persons during outreach, engagement, screening, and education events. They've been provided vouchers. They were offered culturally and linguistically appropriate LTBI education or referred for evaluation and treatment. An equal amount of people were educated about the stigmas related to TB and LTBI in HPI communities, and close to 500 providers, nurses, and healthcare professionals participated, hosted, or collaborated on virtual or in-person trainings, workshops, and events to help improve their community and provider capacity. Next slide, please. Although it is important to acknowledge the successes and achievements of our partners and our alliance, it's equally as important to recognize and learn from the challenges that were encountered throughout that journey. You know, what we learned from this past year's cohort and from several years prior was that there were some key barriers, some acute, some more chronic, that prevented or deterred efforts to eliminate or implement their objectives successfully. As you would imagine, the number one obstacle was related to the ensuing byproducts of the pandemic. COVID restrictions limited group activities, recruitment efforts, and enrollment. And for most of the country, the ever-changing circumstances that emerged from COVID continue to be a great obstacle, but especially for local clinics and community health centers. So these enduring shifts in priorities made it harder to connect with new partners or reach out to the community, which naturally generates delays in executing objectives or building out interventions to the scale that is wanted. The second reported barrier was linked to TB and LTBI stigma, something that was echoed all throughout the summit. You know, TB and LTBI misconceptions, misinformation, and taboos continue to persist throughout community members, even providers, which breeds a cascade of related barriers that proliferate fear, misunderstanding, and hesitancy by community members. Things like the lack of awareness about the availability of treatment options, even finding culturally representative experts or well-respected leadership to create trust in the community is challenging, especially when it's compounded with forces that are beyond anyone's control. One program even reported that the introduction to blood tests versus traditional skin tests in the community can be very challenging in the HPI community. And the impression of drawing vials of blood can discourage many from receiving screening, even though they're at greater risk. And so these barriers point to the sheer need and the concerted amount of effort required to provide culturally and linguistically appropriate TB and LTBI education for NHPI communities and other ethnic minority groups. These challenges, coupled with other technical, administrative, even fiscal issues like the increased price in quantiferon tests and other diagnostic equipment, generate setbacks during the implementation of activities. However, despite these limitations, our partners rose up to the challenge and continue to show up every single day for the communities. And we're so incredibly proud and inspired by their work, which is why we felt the need to spotlight some of these leaders today. Shiva, take it away. Next slide.
Thank you so much, Maria, and thank you for sharing a very much realistic view of what our partners are experiencing that are barriers. But in many ways, too, they are utilizing these experiences and really coming up with innovative and important approaches to reach out to our community, to do that kind of outreach and to really raise awareness and education and to address a lot of these challenges. I'd just like to share some of the uplifting work that our partners are doing. And you'll see here some of our partners from the Asian Pacific Health Foundation, which I'll be sharing a testimonial of theirs soon. And you'll also see some of the community health fairs and different activities that are provided here for provider education. These are just some photos that reflect just some of the, I think, impact of our mini grantees throughout the years. And we're really just appreciative of the amount of lift and work that they've been doing, especially in just 1 year. We're quite impressed with all of it. So it's really an honor to be able to share this with you all. And just want to give them a lot of appreciation for their collective community work. Next slide, please. And again, I want to share a testimonial from Asian Pacific Health Foundation. And this is actually a community testimony that kind of shares a little bit more about their program. I'm going to read it out loud, and feel free to read it out loud with me. Annual TB incidence rates are found at significantly higher levels in San Diego than in any other part of California and the nation. Through the sponsorship of T mini-grant, Asian Pacific Health Foundation has been able to diligently provide TB education to communities across San Diego in an effort to make this knowledge accessible to all and reduce overall TB cases. Over the past year, APHF has been utilizing the grant for a variety of creative informational outreaches, including high school presentations, clinical workshops for providers, and community health fairs for families. In addition, by networking with other grantee organizations, APHF has discovered new partners such as Champions for Health to collaborate with under the same mission. All of these wonderful ventures would not have been possible without the generous contributions from the T mini-grant program. We at APHF and the communities we work with in San Diego are immensely grateful for T's continuous support of our endeavor to eliminate tuberculosis. Next slide.
Thank you, Shibo. The TB Elimination Alliance, as you may know, is approaching its 5th and final year of programming. Thanks to the support of our partners this year, we've been given the honorable duty to offer expanded services and mini-grant funds to other high-risk populations that are disproportionately affected by TB disease, including the non-US born Latino and African American communities. And so our objective has been and will continue to be focused on uplifting and empowering the voices of Asian American, Native Hawaiian, and Pacific Islanders, while also thriving to establish a mutual ownership and lasting partnership with non-NHPI organizations who are focused on health equity initiatives that serve all of our community's needs. And we strongly believe in upholding practices that will protect, honor, and respect the unique cultural identities, beliefs, and traditions of the NHPI community, including our expansion populations. But we can only achieve that with representation, so we encourage community gatekeepers and representative leaders from our audience and these expansion populations to join us in this effort so that we can learn from each other and build a more culturally grounded healthcare workforce. Next slide.
This is just a sort of glance at the partnership that we've been able to build in the TB Elimination Alliance. We're here to kind of highlight some of our members here, from Asian Pacific Health Foundation, NEMS, Northeast Medical Services, to UCSF, TB Free California, Hep B Free Hawaii, and AACS. And these are examples of the partners that have really come together and really focus on, I think, that kind of health equity aspect, and also this initiative of tuberculosis elimination and really having that culturally specific approach. We're very appreciative of all of our partners in this work to continue to do the TB Elimination Alliance and this collective effort. Next slide.
Yeah, well, thank you, Shibo, and thank everyone here for staying with us. We hope that this presentation shed some closer insight into what T had been about and showed what could happen at the local level when state and local TB programs collaborate and partner with diverse member organizations. You know, one of our priorities with our impact and also with our expansion is that we hope to remain steadfast in T's mission to achieve TB elimination priorities and continue to provide culturally and linguistically competent TB and LTBI services to underserved communities of color.
Thank you so much, Catherine, Maria, and Chibo, for that helpful insight about the HBU mini-grant program and the TB Elimination Alliance mini-grant program. To our audience members who are listening in, please feel free to type any questions you have for Catherine, Maria, or Chibo through the chat. In the interest of time, they are going to be answering your questions through chat. Moving right along, now we are going to hear from the recipients of the Hep B United and TB Elimination Alliance mini-grant programs about their projects. First off, we have Sui. Sui is the president and founder of board for Korean American Outreach Group, and she's going to be talking about her project. Korean American Outreach Group is the recipient of a mini grant from Hep B United. Take it away, Sui. You're on mute.
Okay, can you hear me? All right, nice to meet you all. I'm a health education specialist for over 15 years now. My project was targeting college student. So I targeted 7 colleges who is in medicine field, and then I selected team leader for each school, and then it's like a train-the-trainer mode, and the one team leader would recruit their peer group, like 5 or 6 students, and they will do Hep B education together. So first preparation time was developing education material for the college student, and then flyer, and then also developing the letter to all either nursing school professors or any public health related professors, and then career professors, so they could kind of promote what we are doing to select a student. And then implementation phase was, first one was once we select student, and then training them on happy knowledge, and then how to do outreach, and then how to refer the client. So training portion was pretty simple and pretty easy. I had a great fun with that. However, the problem was when trained student, when they're trying to recruit their peer group, it was hard because of the COVID-19. Students no longer gather together to study, and then they no longer hanging out with each other in a campus. So I had to find a different way. So I recruited high school students, because most of high school students, they wanted to have volunteer hours for their school. So they're kind of eager to do. So I had to bring the high school student in, and then let them to find anybody college in George Washington or Marymount University or University of Maryland or Shenandoah Pharmacy School. So they're the one kind of doing my work in the church setting. So they're the one who is finding my team leaders. And then after that, I was able to provide education, and then also supporting them to how to outreach to their peer groups. And then after that, I wanted to build a school-based team cohesiveness. So, whenever they're in nursing school student together, they're kind of talking about Hep B, and they're doing the discussions together. But I didn't find that many Asian students, because my target audience were the Asian. So because of COVID-19, I didn't see that many Asians language speaking students. So I had to also go around, through the faith-based community. So once I find out any Asian student who become as my team leader, and then finding school education platform was not possible. So I had to go through their church or faith-based group. So because they go to church every Sunday anyway, so I let them to find opportunity to speak regarding hepatitis B. So that's how I did it. And then surprisingly, high school was very eager to do it. And then they even after they providing education to 10 people, they were actually doing more, and they asking, can I do it more? So they could earn volunteer hour. So that was kind of relieved side of me, because when I hit the difficulties finding my team leader, I was a little bit kind of anxious. What am I going to do? But luckily, with the high school students' help, I was able to do it.
Thank you so much, Sui, for that great description of how you carried out your project. We will move right along, and our next presenter is Richard So. Richard So is the Executive Director for Hep B Free San Francisco. Take it away, Richard, and he's also the recipient of the Hep B United mini-grant program.
Sounds good. I'll share screen right here. All right, there's a lot, but I'll go through it pretty quickly. We were the recipient of a mini grant to fight hepatitis B. First, I want to thank Hep B United. They've had faith in us to do several projects. Can everyone hear me okay? Sometimes my microphone's a little off. Okay, great. And so this one we did to particularly address the Pacific Islander community because we had, quite frankly, not done that much in the Bay Area. And it was an initiative headed up by our former program manager, Mick, and now with our new program associate, Lena. So quickly, who we are, many of you already know this. We were actually originally, the original SF Hep B Free was founded in 2007 as a response to the need to educate both the community and physicians around hepatitis B, provide free screening, and at that time, potential vaccination. And we've continued on that mission through the years in this area that has so many API immigrants that are at risk for hepatitis B as well as TB. So what is PILOT? It was our cute name for this Pacific Islander liver outreach and testing program to specifically educate, screen, and link to care those in that community, as well as partner directly with the community, because we all know that's how the best public health initiatives are done. So the goals here, they kind of make regular sense: increasing community knowledge, increasing for testing, increasing knowledge and benefit for vaccination and prevention, decreasing stigma, linkage to care, and just general better understanding of the disease. So the methodology, so we did this and we tried to do it the best kind of public health gold standard way, where we recruit a whole bunch of promising stakeholders and people of kind of community power and influence to see what would work for them. We educated those stakeholders and all as a group decided to say, let's take health navigators recruited from your own community, train them, and then go out and do in-community screenings where those trainees know where their community is living, working, playing, and completing education, knowledge surveys, and then following up with screening. The objectives here, we were pretty ambitious to screen at least 100 Pacific Islanders for Hep B, directly educate at least 200, indirectly educate at least 800, and we consider that via like radio or newspaper or any other social media, and then administer at least 200 surveys to test that knowledge, pre-education sessions and post-education sessions. So like I said, we partnered with the PI community and allies to do that. Then there is a group called Taloma for Tongans who we worked with, as well as getting inside advice from San Mateo County staff, as well as this group called Unite Us California or Unite California to tie those who participate into other health and social services. So there were some challenges. Obviously, COVID made hosting workshops harder. So we did do some virtual stuff. It was hard to track participants. So Unite Us served as a potential way to do that. And then navigator availabilities were limited because a lot of them, this was obviously not their main job, despite the fact that we offered some payment for the hours worked. So some of the things we were able to do, we got onto Radio Tonga with some health navigators and major movers and shakers in the community with an estimated 3,000 Radio Tonga listeners. So that was great. We ended up being able to do 2 workshops, and you can see community members here taking a look. This one educated 18 attendees, the other one, I think, around 16. You'll notice we did this at a church, which we know Pacific Islanders a uniting area is their religion and being present at the church. So another good example of going to where your population is. Then we were able to follow that up with a screening done in a neighboring city where we screened 10 people. And just as an anecdotal story, when we were doing that screening, 3 folks came up and said, oh, you should test me. I have this disease. And we explained, if you already know for sure you have the disease, just make sure you're being followed up. And they said, oh yeah, we're being followed up. Oh, so we don't need to test this again. Do we need to do anything else? And we said, as long as you're following your physician's advice, that is how you should be proceeding. So it's definitely in this community, given even that small sample size, when there was about maybe 20 people at that event. So results and challenges. We had 2 initial successful educations and a lot of initial hoorah and positive enthusiasm. But after setting a set of goals and on how many screening or how many educations, which were about 5 per navigator over the year, those never materialized based on, folks saying they got sick or they've gotten really busy with school or work. We didn't want to alienate anyone. We knew that this was kind of something they were doing in addition to their own work and lives. We did have I'll be fair to admit, we did have what I might call a cultural mishap around the food costs for one of the events. It just came in at a lot higher than I had anticipated, despite talking about the fact there might be food costs. And I feel like the educator we were working with was quite offended at my surprise at that. I did apologize and talk about how I just didn't anticipate it to be as high, but it really turned that person off from our work. And so that's definitely a lesson learned. We'll definitely adjust that methodology from then. Fortunately, while we didn't reach a lot of the screening and education goals we had set in the timeline, we are jumping right back in. The addition of Lena to our staff has helped us reach to many, many PI leaders, particularly in professors and PI programs across schools, college level, across the Bay Area, we've met with and want to include hepatitis B into their curriculum. And we're able to give them a little pitch of the reasons, as well as other in-community events. And so we definitely have lessons learned and plan to continue and achieve these goals into this next couple of months. So that is a really good example. I really kind of liked how this project went because it had a lot of kind of barriers and hurdles that we have to overcome. And now it looks like we are indeed doing that. So that's it. I know I spoke really quickly. I didn't want to go way over my time. So happy to take on any questions.
Thank you so much, Richard. Audience, if you have any questions, please type that in the chat and I will ask them after our final presentation. So our final presentation is by Dr. Fayette Gwen Truax. She is the new recipient of the TB Elimination Alliance mini-grants program. Dr. Truax is the assistant professor for Loma Linda University and works at Southland Integrated Services. Take it away, Dr. Truax.
So good afternoon, everyone. Thank you for this opportunity. I first just want to thank T for inviting me to share the work that I'll be doing with the T mini grant that my team have been awarded this coming fiscal year, which is 2022-2023. So again, I am from Loma Linda, but I am partnering with several different entities. The first one is the California Department of Public Health TB program. The second one is the Orange County Healthcare Agency TB department. And thirdly is the Southland Integrated Services Clinic. That's the FQHC clinic that primarily serves Vietnamese population in Orange County. And so I am the glue that gets them together. So I just want to take a few seconds to stress that it is so important to start connecting with potential community partners and agencies early on in the grant process. So if you want to work with these entities and get to know them, develop a good relationship before you even write that grant, because it's really important to have that connection. Next, I was asked to just share with everyone a glimpse of my proposed project that was chosen by the T Grant Committee. And so my team and I are just so excited to have this opportunity to do this project. So the name of my project is Improving Latent TBI Testing and Treatment Among Vietnamese Immigrants Through Culturally Sensitive Education and the Use of a Patient Health Navigator. So the focus of this project is really just to move one step beyond handing out culturally and linguistically appropriate LTBI or TB education to our most vulnerable population, because we do that a lot, but we still feel that they are not really grasping the education that we're giving them. So I feel that it's really crucial that the TB education and message sent to this population is culturally and linguistically appropriate. But in addition, I still feel strongly that the message should be delivered in a manner that can personally relate to the target population. So my team project really focused on two primary interventions. The first is a culturally sensitive education video that's specifically on LTBI. So I developed this video a few years back. The content of this short video with Vietnamese actors in it was developed from a qualitative study that I did with foreign-born Vietnamese patients in Orange County. And the video content basically addresses the most common myths and fears related to TB, LTBI, and it was narrated by a local Vietnamese community physician. In addition, we have two Vietnamese volunteers role-playing the decision-making process of why they should or should not accept LTBI. So I feel that this educational video is different from everything that is out there and can really reach the non-English Vietnamese older population. The second piece of our project is a patient navigator. So we're adding a navigator, which is a person that speaks Vietnamese fluently. And this specific navigator's job is to guide patients who are at risk for TB through the LTBI care cascade, starting after they have been identified to have risk factors of TB or LTBI. The navigator will assist individuals who face roadblocks to get tested for TB or LTBI. Once the patients get tested, and if they're positive, the navigator will be the one to ensure that the patients pick up their medications as ordered and work with them if there are insurance issues. If they have side effects, the navigator will connect them to the physicians. So we're hoping that this navigator will really make an impact on the complete treatment completion in this population. And so those are the two pieces that we're really focusing on this grant. So we're looking forward to it. And again, we're so excited for this opportunity. And thank you, T, for granting us this opportunity. Thank you.
Thank you so much, Dr. Trax. Thank you, Richard, and thank you, Sui. You all continue to do very impactful work. And this also shows that how impactful a mini grant can be for the work you're doing, the support it provides. I do have a couple of questions prepared for you as we continue this conversation. And I would also like to request the audience to type in any questions they have for our panel through the chat. So my first question is for everybody, and I kind of wanted to know, how was the process of applying for the mini grant and the process look like for you? Sui, if you want to go first.
To me, it was fairly simple. Compared to other, grant process, I make a lot of contract with local health departments. Compared to that one, it's very simple. You just created your ID number, and then you just fill out information and clearly describe what you wanted to do, and then how unique your program is.
Thank you, Sui, for that. Richard, if you want to go next.
Yeah, sure. Echoing the same thing. If you guys are all considering, it is an excellent grant, very easy to do. Again, much, much simpler than most grants, even a lot more simple than a lot of the biotech grants that are often pretty easy. I think also Hep B United and the TB folks are invested in our success too. So, it makes sense and it's easy to ask any questions. This is something that every organization, to give you some scope, we have 2 staff members, myself and 1 person. So it's not like I have a grant writer doing this and you need an expert to do it. So please, very easy, go for it. If you think your program is, valid, I would say the one thing is you really want to make sure you do have that, community partner, simply because projects are always going to work way better and be a better use of the money when you're working directly with community partners, as opposed to really trying to make up something completely your own. And you can reach out to all of us for models of how we've done some successful work, and again, things we've learned, so you can avoid those pitfalls.
Thank you, Richard. Dr. Drax?
I echo my peers. So yes, it is a grant that is absolutely doable. So, but do prepare for it. So make sure you read and you address all the contents that the grant requires. But also, before you apply, look at all the previous grantees and what they have been doing already. You wouldn't want to duplicate, right? You want to be a little bit unique. So if you can be a little creative, that would give you an edge to get the grant over others. And so I would actually say, I recommend you guys looking at previous grantees as well. Thank you.
Thank you so much for that. Yes, we do have like an orientation process, and then we do have an application which we think is pretty simple. So anybody who works in the hepatitis B and TB space for organizations and coalitions, I would really encourage you to apply for a mini grant. Moving on to our next question. We all know that you guys have done some incredible work, and mini grants kind of support that. What I want to know is what kind of work that the mini grant allowed you to do that you were not like really be able to do before. Richard, if we could have you go first.
Yeah, I really think, well, conceptually, it's really cool because I can go back each year and depend on it and know that this grant is specifically for our work, which is really, really comforting. I know it's not a lot of money, but you know, as we struggle, like many of us, to apply to everything everywhere, we're always like, are they going to consider this important this year? Did their priorities change? Like, are they going to require something new? Or is this the type of thing where they say, I don't want to fund an ongoing similar project? And with this grant, I know, you know, this is what the money is for, to fight Hep B in a community-based manner, especially not necessarily those tied directly to a clinic. And so that's the first major point. And I think it allows our organization to pick specific either methodologies or communities to focus on, which is also great. It's kind of a nice packet of money to say, we want to fund our staff, but also these community workers, whether they be health navigators, whether it be to rent a church space and be able to give back to those communities in need, or our partner as a kind of a consulting fee, so that they have some vested stake and can feel like we're trying to invest in them as well. And so that direct tie with a grant that's easy to use is really, really impactful for us and something we look forward to each year.
To me, understanding gap between college students, the knowledge based on hepatitis B. Oftentimes, I get interns by, I guess, their practicum that they need to, graduate to. They need to complete in a certain hour. So oftentimes they wanted to do something, but this time I had to find out to recruit, regular student who is in medicine field. So automatically, I was assuming they know about Hep B, but knowledge-wise, they might know, they might heard of it, but as a personal level, how this TB, how this Hep B has been making, impact on their families, on their, friends. So kind of understanding, make it as a personalized to motivate them even more, stronger, and they're trying to protect their own, peer group and own community. I had such a, great time understanding, what's going on. Oftentimes, college students, they don't communicate well with their parents. So they don't even know what kind of health insurance, or if their parents have health insurance or not. So by kind of, participating in this project, they're understanding even their parent aspect. So I had such a great time with that.
That is incredible. I know like there is a lot of gaps when it comes to understanding insurance and what that covers. And it's so incredible that the students that you had were able to understand what kind of insurance they're in, and also their parents' insurance. So
right. And then if I add one more, I didn't think that it would have been that hard communicating with academic, professors. because when I had a project, pretty much they're having a quick response on what's going on. But when I actually trying to build more stronger relationship, many professors didn't even respond to me at all. So I figured, okay, I need to more work on academic field.
Thanks so much for that, Sui. Passing it to you, Dr. Truax.
Yes, from my perspective, this seed grant really gave me the opportunity to approach an FQHC clinic and say, I would like to partner with you and do very important TV work. But if I came in with no grant, I probably would be turned away, which I have in the past many times. And so because of this grant, I was given an opportunity to talk to them. They gave me 30 minutes of their time. The CEO say, okay, but tell me what you have in mind. And I think without the grant, I would not have this opportunity. So I really feel that it's so important to have this grant to connect with the clinics and FQHC clinics that don't really want to be bothered, right? Because they're so busy. So I'm very thankful for the grant, and I really believe in it. And I can't wait, because I know that once this grant is expired, I will continue the relationship with the FQHC clinic, and that's the blessing that I am really thankful for. So thank you.
That's really good to hear, Dr. Truax. We do have one question in the chat. What is the driving force that drove you to pursue the project? And it's directed to all three of you. Dr. Truax, if you want to go first.
So it's my love for the community. I was raised and born in Orange County, and the Vietnamese population has one of the highest TB case rates annually in the last over the decade. And so I'm just being being Vietnamese myself, I just had this passion to do this. And I'm also a researcher, and it's because I work at Loma Linda University, it's easier for me to have the ability to go out there and do that. But working with the community is amazing. It's just, you see things that you've never seen before. You don't realize it because you can read on paper, this is the TB rate, blah, blah, blah. But when you go into the community, you can actually see how many organizations out there are doing this work. And then how can we actually penetrate the Vietnamese population, the older population, to get them to really care about this. And so there's a lot of things that that just intrigues me about this, because I really love it. And I think the passion that we have, and when you go to the community, the people can see it and they will listen to us. And that's why I do my work, because I just want to see that TB rate drop down. But thank you for asking.
Thank you, Dr. Truax. Sui.
For me, my career has been community health. So in order to provide effective education to change their behavior, you must be liked by that population. So you need to find the best way, easiest way, and simplest way to penetrate the information. So they want it to be healthier, and better. So to me, community health has been that way. But particularly, I love working with younger students, college student or high school student, because they're the bilingual. And then if they don't understand what is going on within their community, what their parents are going through, it's hard for them to become as a good clinician when they become as nurses or doctors or pharmacists. So I wanted to kind of plant the seed, when they're young, and then Hep B is one of the great example for students to understand health disparity issue. Many Asian, they struggle with language barrier, and then navigating even their health insurance. It's hard. It's hard for individual, and then also many of them also they don't have health insurance. So if bilingual medicine field student, if they don't understand what's going on, it's hard for non-English speaking immigrant to navigate the healthcare system.
It definitely is, and I can resonate with that. I'm myself from Nepal, and even though I speak English, it was very hard for me in the beginning to navigate the medical system here. Thank you for that, Sui. Richard.
Yeah, I mean, I echo what other folks have said. I'd say if the question was more specific about why we pursued this particular project, I think in our community, we had just worked a lot with the Chinese community because we had the biggest connections there and the Chinatown community, and we had known the community leaders. And I just felt like we were being a little bit biased. And so the year before we had worked, or half a year before, we were already working with the Filipino community. So this time we wanted to work with the PI community, which is significant, but also even within the Asian community, probably has one of the lowest resources because people think, you know, Chinese, Japanese, Korean, or Southeast Asians, and the Pacific Islander folks always seem to be a little bit left out, unfortunately. So we really wanted to focus on that to put some equity on.
Thanks so much, Richard. Moving on to my next question. COVID kind of threw a curveball at all of us, having to navigate it and work through it. In this space, in this scenario, I would like to know, was there any kind of like surprising wins that you've had that really helped or that worked out great? We'd love to know that. Richard.
Yeah, I think, you know, what keeps me going is the fact that I feel like I listen to people who come up and say that we're making a difference, even if my data doesn't show it. So quite frankly, despite the fact that Hep B is supposed to be 1 in 12 immigrants, we've only been screening immigrants, and we've only gotten like 1 or 2 cases or positive results in the past couple of years. There's some potential reasons for that. We think the Bay Area has more wealthier folks, or the folks who do have it are under treatment. We have a very different population than that in New York City or even in LA. But other than that, you know, almost every event, someone comes up and says, oh, I have this, or I know about this. And I'm like, how? And they're like, I have this. And then they're like, tell us about it. And a lot of times they'll say, it's really cool that you're doing this. You know, nobody told me when I found out. I feel like I got lucky. Or they'll say that exact same thing with a more somber face about a relative who passed away. If only people like you were saying something out there. Or then you get the folks who kind of listen to the facts about Hep B and they're like, kind of have this frightened look in their face and they're like, are you serious? Like, it's that common? What? I wouldn't know. I should get tested. Ha ha ha. And I'm like, yeah, like, ha ha ha. But yes, you should. Like, let's like, you can do the 5-minute test right here with our phlebotomist. And then the final couple things is when we put up a YouTube series called Living with Hep B, where we were interviewing folks and just trying to have like kind of a friendly fireside chat where people can just talk about their lives. We've gotten like 5 or 6 emails out of nowhere, totally unprompted, of people saying, hey, I happened to run across your YouTube series. And these are videos that get like a total of like 46 views, you know, 86 views, something like that, even though they've been up there. They'll say, it's so cool that you have that I can hear someone else like me. Just wanted to tell you that. And, you know, they're small wins, but I'll take them, and it's what makes this worth doing.
Every win counts, so that's incredible. Sui.
Well, COVID situation kind of served me good and bad. Good is all of a sudden there's a lot of work kind of dumped it at me. So I had to do a lot of COVID-19 outreach. So because of that, community, they were seeing my voices and my voice and faces through the media. So it kind of gained more, I guess, credibility on what I do on Hep B. And then downside was because of COVID situation, student doesn't really gather together and then mingle together. So it was kind of hard, harder for me to find my target audience. So that was kind of downside of it.
Thank you for sharing. Thank you for sharing that, Sui. Dr. Truax, I know you're in the process of developing your program, but I wanted to know, is there anything excited, any aspect of the project that's exciting to you or that you're really looking forward to?
Well, there's a lot of things I'm looking forward to this project, because especially it's a partnership between the community and also the state at the state level. And I'm doing something unique with the video that is very culturally, linguistically appropriate. But I do have something to say about COVID, because COVID was really hard for me, because I am the person who connects people together, and no one wanted to be connected during COVID. But however, one of the connection I have is I work with the county, and during COVID, we were able to we were invited to do a talk show, a TV show, TV clip on a talk show. And one of our county physicians was able to be there and did a fantastic job. And that reached a huge audience, more than I expected, right? Because it was on the Vietnamese channel. And so that was a blessing that we had during COVID, that we were able to do that. And so I'm really excited. And now we're able to do future shows with them as well. So I wanted to share that. So don't be too depressed. Even though COVID hit, we were able to find ways to educate the public. And so I just wanted to share that. I know we're out of time, but
Thank you so much for sharing that, Dr. Truax. We are almost out of time, but I do have one final question for you, and that's for you, Dr. Truax. Somebody asked in the chat that, are there specific factors driving stigma about TB in your Vietnamese community and way of overcoming it?
Wow, because the stigma actually, it dates back to the cultural belief from our, I don't want to say just Vietnamese, but a lot of Asians have this. And so the group that I'm actually specifically targeting is the elder or the older Vietnamese population, not the younger group. If it is younger, it's those who have immigrated here from Vietnam. So it is tough. In Vietnam, they don't believe that, latent TB needs to be treated. And so it is such a hard, it's a battle for me to actually get to convince them to say, hey, it's important that you get screened and tested. So that's why I developed this specific video so that they can see a scenario of a couple who actually were diagnosed with latent TB and how they decide whether they should or should not take the medication or get tested. And so I know it's an uphill battle for me. I know that the population is very stubborn because they're older, but they can be reached if we do it the right way. So I have a positive thinking. I think I can do it. So I'm looking forward to the data that we'll get from the project that's funded by TB.
Can I add for the stigma? I used to work on a TB campaign when I worked at Fairfax County Health Department. So I actually did a pilot project for what they believe in the community, their perceived threat and perceived barrier. So Vietnamese population, they didn't know that TB was curable. So when I created educational material, I had to highlight it. TB is curable. For Chinese community, they didn't know that TB treatment was free by the county. So I had to indicate that if you have this symptom, come to the health department, it's free. For Korean community where I live, they thought that TB does not exist in Fairfax County. So I had to emphasize on educational material that if you see this symptom, it could be one of the TB symptoms. So come and check it out. So each community, they have their own different, misconception. So it's really important to break down, their myth.
Thanks so much, Sui. And thank you, Dr. Truax, Sui, and Richard for joining us today for this incredible panel. Your passion is visible through your talk, and please continue doing the work you do for all our audience. If you work in the hepatitis B and TB space, please, we encourage you to apply for our mini grants. With that, we come to the end of this session and the summit. Thank you everybody for joining us for the last day. Thank you to all the members of the HBU and T, as well as the leadership for all their support for this summit. To close us out, we have one final message from the co-founders of HBF, Tim and Joan Block. Thanks, everybody.
Hi, we're Tim and Joan Block, co-founders of the Hepatitis B Foundation, and we are very pleased to have been asked to say a few words as you're closing out your Hep B United Summit. I wanted to point out, if it hasn't already been noted, that this is the 10th anniversary of Hep B United. We were started in 2012. Jess Caballero from APCHO and myself started the Hep B United Coalition with the goal of creating a national network of all the groups who are working on hepatitis B and liver cancer in their communities. And it's with a great deal of pride that I look back now after 10 years, we succeeded. And I'd like to specifically thank Jeff for being my partner in all of this, and also to thank Dr. Sherry Cohen, who is now president of the Hepatitis B Foundation. Congratulations, Sherry. Very well deserved. And to also thank Kate Moraris, who helped lead the Hep B United Coalition for the past 9 years. Welcome aboard to Frank Hood, who is now coordinating the coalition. And I want to thank all of you for all that you've been doing. in your communities and nationally. Together, we are so much stronger. And because of you, there really is hope that we can eliminate hepatitis B and really reduce the health disparities caused by hepatitis B in our AAPI communities. So thank you and congratulations to all of you.
So the Joan and Tim Block pair, I'm obviously Tim, and with all the gratitude and thanks going around, I'd like to thank you all. And I want to thank you all for the advocacy that you express and work on in Washington and with other legislators throughout the country, promoting funding for hepatitis B and liver cancer research. You know, really, I hope it's not too crass to say that without money, the research would not be possible. And the advocacy in which you've all been engaged has actually had some great beneficial impact, raising funds and not only awareness, but funding for hepatitis B research. It's making me much more confident about the future. And you know, it's very important that we keep this pressure on and we keep hepatitis B central. Coming out of the pandemic, it's never been more important as interest in hepatitis B in the research community goes up and down. You guys keep it steady. The Hepatitis B Foundation keeps it steady. So thank you for that and expect good results.
Thank you very much. Safe travels home, everyone.
Bye-bye.
Bye.